As Chris mentioned, the three of us are part of the Mayo Clinic Center for Social Media. I was added to the external editorial board in March, I think it was. Chris, back in September, I think it was. He was part of the first generation. I'm part of the second generation. Now we're both members of this. And it turns out that NAPH is a member of this. Maya is involved in this. That's how she got to know Chris and I. And the fact that I should have added the organizer's name here, Lee Aase, A-A-S-E, and all of these people are on Twitter, so he's at Lee Aase, and he set this up, he runs it, and it's just a tremendous organization. It shows how a very well-respected medical center is using social media to be on the cutting edge of healthcare. And what's so interesting about this is he's getting anybody else who wants to be involved in on the action and training them. So there are educational websites here, how to use Twitter, how to use Facebook, how to use SlideShare, and so on. And plus, it's an organization where you can exchange information. And I had a video here. It was from the Mayo Clinic. I've tweeted it. A number of us have. This is up on a guy here in Chicago, Dr. Ves Dimov. I don't know, most people here aren't from Chicago, but he's here. And he happens to be one of the physicians who's connected to social media, and he sent out this, how Twitter brings patients to Mayo Clinic. It was a 2-minute video, and you'll have to Google it and watch it yourself. Okay, so as it must be clear, I involve social media into medical education. I do it big time. This was an ad that was circulated around our campus to get students involved in signing up for this medical elective. It's only 2 years old. This is all very recent stuff. The middle question here, how are PHRs, EMRs, and social health computing changing medical practice? So right front and center, I'm telling the budding docs that they've got to know healthcare social media. They've got to be well-versed in it, or they're just going to be out of the loop. I use Twitter. I found it as a good tool to communicate with the people. That way, we're essentially always connected. It's much faster and easier than email, much so, in so many different ways. I have a medical student who's now going into his 4th year. He has his own blog. I was going to show his video. So he's got a blog. He tweets. He does mini videos that are 140 seconds, like the 140-character tweet. Okay, keep it short and sweet and to the point. And that just goes to show you that students are catching the wave. I didn't tell you anything about the genomic part, but that's a big part of what I do, genomic medicine. And it's covered also by social media, and this is just something that was picked up by our local newspaper, and it's a part of shameless self-promotion at the moment. Okay, so take-home messages. This is what you want to take home with you. 21st century medicine is called out there, medicine 2.0. That's where we are. It will be information-driven, not just genomic, but even social media-fed, patient-informed via crowdsourcing, widely communicated. Very different from the olden days, very different. Umbrella term is personalized medicine, but by 2030, all medicine will be personalized, so we won't use that term. Right drug, right patient, right dose, right time. That's what personalized medicine is, or it's also known as P4 medicine, where participatory via social media in particular is a big component. And it's a shift in focus from sickness to wellness. And here's a major point for our institution. Hopefully it will be for years. Budding docs should be trained for a practice that presently does not exist. And that's the mantra that I go into our university to do education there. 5 ways to ensure mediocrity. I show this to our medical students when they first sign up for the course. Assume current medical school faculty and physicians already know everything, and thus so will you. Assume the world stops changing when you decide to do so. Ignore the contribution of the Human Genome Project to understanding and treating human disease. That's the genetic aspect that I didn't talk about today. Ignore impact of social media on healthcare. So I've got both components there. Internet, through social media, through internet, and the Human Genome Project. Fail to appreciate the dramatic impact of technology on healthcare. So for mobile health, everything is moving to mobile, to iPhones, to your phone. And then finally, not 5, 6, overlook the contribution you can make. And this is directed to the students in particular. So getting them in on the act of innovation, at least at a minimum, helps them to appreciate the innovation that's going on, whether or not they choose to acknowledge that it's actually there. All right? So I decided to do a grassroots approach to changing our curriculum at our university and start with the students up, because medical schools are entrenched dinosaurs. To start from the top would be fruitless. So, and it's working. Get the medical students excited. They say, look, administrators, you've got to get on this bandwagon or we're not going to be trained right, all right? And that's what it comes down to. So we're making good progress, and we've had some good success in publicizing it around the country. Okay, so that's everything I have to say. My last slide. Okay, thank you.